New Mexico, where it's clear that mental illness, severe mental illness, aligns with poverty, and we are in one of the poorest states in the country. We need to have a more robust inpatient care setting.
Coming here myself, being a veteran, I have post-traumatic stress disorder, so I've been trying to find somebody who's actually really qualified in behavioral health, not just trying to shove medications down your throat.
Nobody understands what it's like to be depressed. Nobody understands what it's like to have bipolar disorder. Nobody understands what it's like to struggle with being an alcoholic.
I feel that there's services right now that meet my needs, and I feel that this could reach levels of discrimination if the system doesn't make an immediate fix.
I've been in the behavioral health system. I am part of the behavioral health system, so it's not like it's something out there. I'm a part of that system. And anytime we think that we're not a part of it, we have to think twice about it.
I lost my father to suicide 6 years ago, so I found my passion or my purpose in life out of the tragedy of losing my dad. We're very Hispanic, and we don't like to talk about being sick. We don't want to say we have a problem. We all are perfectionists. I see it in my family, I saw it in my dad. He wanted to be the perfectionist. He never wanted to say he needed help. He never wanted a handout. He didn't want anyone to know about that, so he never reached out for services. He continued to go on his downward spiral. We need to be the front line because we can't depend on the system.
I wonder where my children are. I mean, I call them my children, the ones that I worked with. There's no facets, there's nowhere for them to go right now to go get therapy.
As New Mexicans, we're all impacted by this. It's our problem. The system is there to serve our needs. What we should speak about is what the system can do to change itself for the improvement of helping New Mexicans, regardless of where you live, regardless of your background, regardless of your resources, because this affects our life. It is our first priority, not just to have a quality of life, but a life that actually improves and can be changed when we come seeking for help.